Welcome back. Presumptive Republican presidential nominee Donald Trump has selected Indiana Governor Mike Pence to round out the Republican ticket, a choice that has not come without controversy. Governor Pence, the target of criticism for taking advantage of a Medicaid expansion program under Obamacare. Pence did, however, reach a deal that allowed a number of conservative modifications, including a provision that did not exempt those living at or near the poverty line from out-of-pocket costs. Joining us right now is the president and CEO of the Cleveland Clinic, Dr. Toby Cosgrove. Dr. Cosgrove, great to see you.
Nice to be here.
Thank you so much for joining us. We want to hear about preparation for this week. But first, let me get your thoughts on Obamacare and the impact that it has had in the industry.
Well, it's had tremendous impact. It's changed the way we're going to be paid. It has increased the number of people who are covered, some 20 million. We've seen the quality of health care measurements across the country improve. The real question is what it's going to do to the rate of inflation in health care. If we saw inflation rate coming down since 2008 to lowest to 2.6, it's on its way back up now. It's about over 5. And I think that probably has to do with increasing number of people being covered.
Right, because when we speak with business managers, they continue to complain about the cost of the health care legislation. And, you know, they want to keep the number of employees below 50. They want to take hours from full-time. So does that sound familiar to you?
It sounds absolutely familiar. And what we're seeing is that health care costs are going up, and who is bearing the burden of this is private insurers. Because we lose money on 60% of the people we look after, Medicare, Medicaid, and people who are not don't pay us at all. And so there's a cost shifting that goes to people who are insured. Interestingly, more and more people, however, are shifting to some sort of government care away from insurance, and that is causing difficulties for the providers because we're not being paid. We're being paid less and less for Medicare and Medicaid as we go forward.
I think that a lot of times when we talk about Obamacare, it's, you know, the cost or the impact on businesses, but how does it impact patients?
Well, it's impacting patients in a couple of ways. One, more people are being covered, and more people are being treated, and secondly, the quality is going up. So patients, I think, are benefiting from it, and if you look at the polls, and now 50% of the people in the United States approve of Obamacare.
Would it have been better had there been some of the changes done incrementally? Because a massive shift like this, for example, of electronic medical records, they have to implement them, but the systems are not required to talk to each other. So they're useless in some cases if a person's medical records can't translate into somebody else's system.
Yeah, and electronic medical records have been a step in the right direction. However, we need to have interaction between the various ones. I think that's going to come in the next year. That we will do that. And so medical records will be able to be transported across state lines and between hospital systems, et cetera, which is absolutely important, as you point out. Now, we're now 6 years into the transition, and it is very difficult for us to do this. One of the things that all of us need to do is make care more affordable, and we need to take costs out of the health care delivery system. Really only 2 ways we can do this. One, we have to have a more efficient healthcare delivery system. And 2, we have to decrease the burden of disease. Smoking and obesity being the 2 really big ones that continue to plague the general population. We have to begin to understand that the population has got to do something about this if they're going to want to decrease the cost.
Well, I think you make a great point, and we should point out that you're a cardiac surgeon.
A recovering cardiac surgeon.
So you know a lot about this. So where are we in terms of heart disease? Still the #1 killer?
Heart disease still is the #1 killer, although the rates have come down. It looks like the rate of improvement in deaths from heart disease is sort of leveled off now. But it still is the #1 cause of death in the United States and the world.
Wow. And you've been such an innovator at the Cleveland Clinic and throughout the industry. Technology, is that a big, mover in terms of moving the needle on this?
Well, technology is vital to what we're doing. You see new apps, new Fitbits, new ways we can look after patients. We're doing more virtual visits.
Wow.
And actually, we've now got a system for strokes. If you have a stroke here in the city right now, or symptoms that, we dispatch an ambulance that's got a CAT scanner on it. So we can pull into your driveway and do the CAT scan right there, which decreases the time and saves brain cells in the treatment.
Wow.
Very exciting stuff.
That's a huge deal.
Should we be doing more in intervention, or rather in prevention rather than intervention? Because it seems like we'll never catch up.
He's all about prevention.
Intervening.
Absolutely right. Absolutely right. If you just look at it right now, 10% of the health care costs in the United States secondary to obesity. Still 22% of the people in the United States smoke, the #1 preventable cause of cancer. Great opportunities to do that, and this is going to require that the individual begin to take responsibility, and there's a nice opportunity for government to for private industry to step in and begin to drive their employees towards health.
What are some ways that they can do that?
Well, for example, we don't hire smokers anymore at the Cleveland Clinic, and it is interesting. It's had a carryover effect into the community. The community smoking rate has gone from 22% to 15% as we did this as a sort of a leader.
You will not hire a smoker, and you test.
We test people coming in for nicotine, and then we offer them free smoking cessation if they test positive, and if they stop smoking, then we will consider hiring them again.
Wow. All right, let's talk about the convention and what that has brought to the city, and how prepared you are if we were to see issues.
Well, first of all, we're thrilled to have you here because, as you know, Cleveland has gone under quite a renaissance over the last little bit. We've moved from the manufacturing location to healthcare and technology. So we're delighted to have you here. We're very prepared. We've made a tremendous amount of thinking and planning to go into this as far as health is concerned. So we couldn't be more ready or more pleased to have you all.
Yeah, well, the Republican National Convention is a big deal. There are 23 vendors, and I don't know how many people are descending on this city, but you said that you're worried in terms of trauma, in terms of people getting hurt from protesting, and you feel you have the right things in place. You've increased.
We have doubled up on almost everything: security, emergency rooms, transportation, etc. We're ready.
All right. Dr. Cosgrove, always a pleasure.